Good afternoon, everyone. It's 3 o'clock on the East Coast, and we're going to go ahead and get started. My name is Stan Orchowski, and I'm with the Justice Research and Statistics Association. We are one of the partners on this project, and I will be your host for this session. Before I turn it over to Susan Howley, who's our moderator, I want to cover a few logistical items. We will be recording today's session for future playback. The link to the recording will be posted on the JRSA website and emailed to you, so if there's anybody in your office that wants to listen and view the webinar that couldn't make it today, please feel free to share that. Today's webinar is also being audiocast via the speakers on your computer. If you don't have speakers or you would prefer to use your phone, please use the number contained in your registration email or on the event tab located at the top left-hand side of the screen. If you have questions for the presenters, we encourage you to submit them using the chat feature on the right side of your screen. Please select Host and Presenter from the drop-down menu next to the text box. If you'd like to communicate with me as host during the webinar, please submit your comment using the chat feature to host. The session is scheduled for an hour and a half, and we will end promptly at 4:30 p.m. on Eastern Time, if not sooner. If you have technical difficulties or get disconnected during the session, you can reconnect using the same link that you used to join the session initially. You can also call WebEx Tech Support at 1-866-229-3239. In the last 5 minutes of today's webinar, we're going to ask you to complete a short survey, and we'd appreciate it if you take a few moments and answer those few questions. Again, thank you very much for joining us, and I'm going to turn this over to our moderator, Susan Howley.
Thank you so much, Stan. Again, this is Susan Howley. I'm with the National Center for Victims of Crime, and I was the project director on this exciting project. I see a lot of familiar names out there among our attendees, and I'm so glad you could join us. I do want to start, of course, by acknowledging that the presentation of findings we make today are those of the project staff. This project was funded by the Office for Victims of Crime at the U.S. Department of Justice, but none of what we say here today represents the official views of DOJ. Just had to get that out of the way. Let me tell you a little bit about why we undertook this work. This project really grew out of OVC's Vision 21 initiative. They funded an 18-month initiative to really examine where the crime victim services field currently stands and to define a vision for the future. And as part of that process, they realized that victim services providers really lacked access to the data that they needed or to relevant research. And so they funded this project to help them think about how to bridge the gap between research and practice in victim services. The ultimate goal of this project was, of course, to develop a more effective response to crime victims, families, and communities harmed by crime and abuse through the use of research and researchers and practitioners working together. So our plan involved many stages that each fed into each other. We wanted to really get a full picture of the current state of crime victim research and translation to practice, of the challenges out there and the potential solutions. So we started with a literature review to figure out not only where the crime victim services field stood on this, but what lessons could we learn from other related fields. We held a series of interviews with 27 expert researchers and practitioners who were already hip-deep in trying to bridge the gap between research and practice in this area. The Urban Institute conducted a survey of victim service providers to better understand their attitudes and experience in working with research and researchers. And JRSA did a similar survey of researchers to find out their attitudes and experience in working with victim service providers. Following that, we went out to 6 different sites that we thought were doing really exciting work to try to bridge the gap, to see what we could learn from their experience and the methods that they were using. We brought all those findings to a group of stakeholders that we convened with OVC to reflect on the findings and help us think through what were the implications and what might we recommend for OVC. And as you can see from this stair-step illustration, the project concluded with us making recommendations to the Office for Victims of Crime on what they could do through their grant making, through their partnerships, and through other activities to help bridge the gap. But we thought it would be really instrumental for all of you who are interested in this topic to really hear from us what we learned, especially through the research portions of this project, the literature review, the interviews, and the surveys. And so with that, I'm going to pass the microphone to Jennifer Yonner from the Urban Institute, who will tell you what we learned through the literature review.
All right, thank you so much, Susan. I'm Jennifer Yonner. I'm a senior researcher at the Urban Institute, and I will just briefly present some of the lessons that we learned from our comprehensive review of the literature, really focusing on barriers and strategies to integrating research and practice in crime victim services. So as Susan said, this was generously funded by the Office for Victims of Crime, and a real partnership effort among all three of our organizations. I'll talk briefly about the simple goal of the literature review and the methods that we used. I'll present a conceptual model that helped us sort of frame our understanding of these issues, and then describe some of the key barriers and promising strategies that emerged. And I think we're going to be holding comments and questions to the end of this webinar. So basically, we're just trying to identify the key barriers and strategies for bridging the gap between research and practice in victim services. But because this is still a relatively new field, we also looked to see what we could learn in other fields as well, particularly health and substance abuse and education. And we reviewed both published reports and informal working papers, everything that we could find about this issue through searching the internet and different journal databases, and also funders' project reports pages. There we go. And this sort of presents a conceptual model that we adapted from Greenhouse and Associates, and also work by Vivian Tsang. Just shows you the larger picture in which researchers and practitioners need to work together. Everything is heavily influenced by funders, providing the resources to both researchers and practitioners at the government and private foundation level, and also the agendas that policymakers at the federal, state, and local level are setting. And innovation as well is affected by all of that, and everything is couched in the outer socio-political and economic context of the world at the time. But the key point of this really is that there has to be a two-way sharing of information between research and practice for movement forward. Researchers and practitioners need to work collaboratively. It's not just a push of research findings out to practitioners or just a pull of the information that practitioners think they need. It has to be a collaborative movement forward. Another key piece that we found that helped us frame our understanding of the barriers between researchers and practitioners was this bird's eye view of the differences between the two groups that we're reprinting from Terry Farragher. She had presented us a couple of years ago. So basically, researchers obviously were data-driven, focusing on the larger picture, the forest, and viewing victims more as data points. We're operating in a competitive academic environment and striving for objectivity and standardized protocols compared to practitioners who are really focusing on the individual victims, the trees in this analogy, and they're trying to serve victims in a protective way and also working in a collaborative multidisciplinary environment and striving to give the most effective services to help each individual victim. But the other key point of all of this is that we're both striving for the same ultimate goal of making a difference in people's lives, helping improve lives and outcomes for victims of crime. So just to sum up some of the key barriers that emerged repeatedly across the different work that we looked at, limited resources. Nobody has funding, time, or staff for integration efforts. And effectively integrating research and practice requires a lot of extra communication between people who may not have worked together previously, training, implementation, and evaluation activities. Obviously, again, there are cultural differences between researchers and practitioners. That gets at the previous slide about the forest versus the tree perspective, both of which are important. Researchers, of course, are valuing empirical findings, whereas practitioners are more drawn to personal experiences and examples. And then both research and practice organizations can suffer from inefficiencies and resistance to change that would better facilitate integration. There's obviously a host of challenges with conducting evaluations and disseminating those findings in clear ways. And there's limited agreement on and syntheses of the evidence base in the victim services field. And then lastly, there are a host of challenges actually conducting, implementing new innovations, whether to use standardized or individualized protocols, all of which require staff buy-in and training. And a number of different strategies emerged. We sort of grouped them into relating to finding, evaluation and dissemination, implementation, online resource centers, social interactions between researchers and practitioners, and then ultimately collaboration strategies. So I'm just going to touch briefly on each one of those and pass it off to Janine after that. Okay, so basically what emerged as promising would be funding that requires evidence-based practices and also encourages researcher-practitioner partnerships. Streamlining funding in particular for programming efforts that also supports evaluation. Typically researchers receive funding from, under a certain pot, and practitioners are getting separate funding, and so streamlining those two efforts would really help move things forward. Using more flexible definitions of what constitutes evidence-based, especially in a field where innovations are still developing. Requiring outcome tracking to improve victim services, but not to enforce the accountability of practitioners. And so in terms of evaluation and dissemination strategies, really those that are focusing on improving the amount, quality, usefulness, and accessibility of research findings. So again, getting back at the two-way street, we're not talking about researchers producing outcomes that are not useful, but really ones that are meaningful to researchers and also useful to practitioners, or what Chris Sullivan had called the dual-use outcome. And empowering practitioners with evaluation tools, or perhaps better yet, linking them up to research partners that can help save them time and money. Conducting systematic reviews that help identify gaps in the literature on effective victim services, and developing comprehensive research databases that are clear and accessible to general audiences. And then ultimately disseminating research findings in person or by video or in practitioner-friendly briefs is much more useful than journal articles that may not be read by such a wide audience. And implementation strategies focus on training practitioners to understand and apply research findings. And some of the literature we reviewed showed that in-person training that was sensitive, appropriate, and backed by best practice information was the most effective, particularly those that incorporated active learning techniques like role-playing and provided practitioners with opportunities to discuss and practice new methods. And then obviously coordinated multidisciplinary efforts that were led by state or federal agencies or coalitions. And there are a number of what we call online resource centers that are out there right now with varying degrees of comprehensiveness and accessibility. So, repositories of practitioner-friendly research findings, training materials, videos, and webinars. Those that were the most comprehensive, yet also easily accessible, and had fair and transparent rating systems for what type of research they included in them, emerged as the most useful and promising. Resource centers that provided opportunities for both groups to connect in person, either at trainings or at conferences. And though there is currently some limited end user data on who exactly is using the online resource centers, currently it does seem to be that state legislatures, policymakers, and victim service coalitions may be the biggest audience. Then also strategies for increasing opportunities for practitioners and researchers to really connect and interact on a social level. And the most promising in that regard would be in-person meetings that facilitate dialogue between researchers and practitioners that can help establish trust and rapport, and then online webinars as well, such as this one right now. And then lastly, collaboration strategies. This is actually when researchers and practitioners can work together in partnership to produce findings that are useful and meaningful to both groups, either for a one-time project or ongoing partnership efforts. Successful collaborations involve, obviously, resources and commitment on both parties' part, supportive institutional cultures, a shared purpose and mutual respect among both groups, and well-defined roles. What are the expectations of the practitioner, and what role will they have in the final outcome of a researcher's evaluation, and vice versa. Well-anticipated outline of the challenges that might be encountered along the way, and obviously efficient communication between the partners in a collaboration. Those are sort of the most promising ways of conducting a successful collaboration. So just in conclusion, research and practice integration requires a two-way information sharing and collaboration. The literature shows that practitioners must be willing to accept the necessary requirements of evaluation, but researchers must also be flexible to accommodate the concerns of practitioners who are delivering victim service. And now I will hand it over to Janine to talk about the survey we did of practitioners.
Thank you, Jennifer. As I'm going through these findings related to our survey of practitioners, I just want to start by saying one of the very interesting things the team thought was happening as we embarked on each stage of this project that Susan outlined at the beginning is the striking similarity between what we learned from victim service providers in particular and what we learned from the literature review from other fields that Jennifer just presented. So I want to say that as an introductory piece to the victim service provider survey, as you're thinking about themes running through the course of all of these presentations and stands to follow. Basically, the idea behind conducting the survey of victim service providers was to understand their own perspectives on victim research and particularly ask them about some of the barriers to success that they saw around research and practice collaboration. What we did was we pulled a random sample of 500 victim service providers through two national databases, NCVCs and OVCs. We got rid of duplicates in those databases and then pulled 450 randomly selected victim service providers who were locally community-based, and then 50 state coalitions of a variety of types of victimization focus. We conducted extensive work to validate the contact information for each person we pulled. We launched the survey in September of 2014 and had it fielded for about 4 months, and we were able to achieve a 67% response rate, so 333 agencies participated in the survey. We asked the representatives from those agencies about their agency characteristics as well as how they use research, if they experienced any barriers to that use, the relative importance of research in their work in their view. We specifically asked about these online resource centers that Jennifer introduced during the literature review. We also asked about if they were to have collaborated with a researcher in the past or currently, what were their perceptions of how that was going and whether or not there were any characteristics of that relationship that might lead to its success or its failure, depending on the nature of which the relationship happened. And then we also asked about promising steps for integrating research and practice. In terms of who we surveyed, the 333 agencies covered all the 50 states as well as Puerto Rico and Virgin Islands. Nearly all of them belong to a state coalition or were government funded. About 1/4 were a part of a national organization such as MAD, and they were quite small agencies, so more than half of them had staff of 25 or less. In terms of the person who was actually the respondent of the survey, half were executive staff, about 1/4 were mid-level managers, and about 1/4 were frontline staff. They were quite educated and experienced in the field. 71% had over 10 years working with victims, and half had at least a master's degree. In terms of their focus on which types of victims that they provided services for, you can see here that the majority said they focused on domestic violence, sexual assault, or child abuse. And you should know that the agencies were allowed to identify all the different types of victimization that they might provide services for. So these were not the primary victimization focus, but a variety of victimization focuses that they might work on. And you can also see here that for the most part, many of the types of victimization that were being focused on were agencies that were about evenly split between criminal justice-based providers and then nonprofit community-based providers. I'm going to start by explaining that overall we felt we had 3 takeaways from the survey, and then I'll dig into the details of each one. First major takeaway of this study was resources are needed to support research and practice partnerships, and this included all varieties of support, among them funding, time, and training. Second, that substantive relationships between researchers and practitioners facilitated the collaborative relationship and led to success. And finally, that practitioners identified interactive activities as being the most effective and useful at facilitating their learning around victim research as well as evaluation-based research. So, focusing first on takeaway 1, resources are needed to support research and practice partnerships, including funding, time, and training. We found that among the providers we surveyed, most were aware of research, but less than half said they were comfortable saying they were familiar with the research base in victim services. The most common research activities that they conducted themselves at their agencies were around client tracking, so tracking the services being provided, whether or not clients were satisfied, and whether or not what types of outcomes they were achieving in regards to the services. Few had partnerships with external researchers or had internal research staff that were actually employed by them. And the most common activities that they conducted in order to become familiar with victim service research was attending conferences, attending online training or webinars, talking to knowledgeable colleagues, and attending in-person training. The types of research experience that they themselves had, you can see here from this graph that about 1/4 had no type of research experience, but just less than half had participated in research studies, and 42% had completed a research course. So in terms of the extent to which they were actually conducting research, you can see that the minority of agencies were actually a part of research processes or had experience doing so. Here's a quote from the survey that was provided that we felt was particularly illustrative of the idea that funding support was a very primary concern to providers in their ability to be able to participate in research efforts. And this provider said, a year ago, I attended a 2-day event which brought together researchers and DV practitioners around issues similar to this survey. It was a good idea, but essentially yielded nothing without further resources and support for continued cross-disciplinary collaboration. Relatedly, we asked specifically organizations about barriers to research use at their organization. Here you can see from this bar graph that among the top ideas cited, in yellow we identify which ones are related to lack of support in order to conduct it. So you can see that over 50% said it's insufficient funding to implement new ideas and insufficient training to implement new ideas. Further down, you can see that insufficient time and ongoing support to implement new ideas was also identified. So we allowed each agency to answer the variety of barriers they were experiencing, not just one particular barrier. And you can see that among their top most commonly cited reasons why they have challenges accessing and using research is around time, training, funding, et cetera, resources. About 14% of our victim service providers that we surveyed had experienced an unsuccessful collaboration with a researcher. And so once they identified that they had an experience with a researcher and they would characterize it unsuccessful, we asked why they thought that might be the case. Again, we allowed each agency to identify all the variety of reasons they thought something might be unsuccessful, but the single most important factor that was identified is that they did not receive funding to participate in research. Okay, shifting focus now to takeaway number 2, and a reminder that this was substantive relationships between practitioners and researchers facilitate collaboration success. Excuse me. We asked about important factors for successful research and practice collaboration, and we learned that the primary answers were around these are relationship-based. That specifically, practitioners got to be part of the decision-making process and the design process for research, that they felt listened to by the researchers, and that they also felt that the researchers understood their day-to-day work and their daily activities and the victim service offerings they provided. They also responded with that practitioners and researchers who created relationships that went beyond the individual research task or activity that was funded, created a stronger, more collaborative relationship. And these were dependent upon face-to-face interactions, so that the practitioner and researchers were getting together and building those relationships. So we asked what types of funding would be most useful to helping providers evaluate their own programs and understand research. And you can see here that the most commonly cited type of funding that would be useful to them would be to actually partner with an external researcher. So 48% said this would be the way they would want to be trying to look into their own programs or understand research, is to actually work with another person, a trained researcher, versus giving existing staff more time to participate in things or hiring new staff. Again, looking at that group of victim service providers who had a relationship with a researcher that they would characterize as unsuccessful, when you look again at the top reasons why was it unsuccessful, you'll see here with the highlighted items that these were about relationships and researchers taking into account the practitioner's ideas and knowledge when it came to implementing the project for their agency. So with 50% reporting, the researcher told us how to collect data and were not willing to modify activities, so not taking their points of view or recommendations. That the researcher had very specific research questions coming into the project and didn't ask for input, and that the researcher didn't actually spend time learning about the organization. Less than half, about 42%, had experienced a successful collaboration with a researcher. And again, we asked, why would you say that was successful? And here you can see these are, again, very much relationship-based and collaboration-focused responses. So researcher, with the top choice being the researcher listened to what we wanted to learn, that the practitioner helped determine what information to collect, that the researcher met and interacted with the staff, that the researcher helped deal with data collection issues that arose throughout the study. So you can see here all these top, over 50% cited reasons why it was successful are very relationship-based. The researcher learning about the agency, learning about the victim service offerings, getting to know the staff, and helping to collaborate around research design issues. We asked providers if they had negative perceptions around working with outside researchers. Over half said no, they didn't. But for those who did say they had negative perceptions, you can see here the most commonly cited reasons were that researchers didn't understand their service practices and they didn't understand their clients' needs. Again, speaking to that idea that researchers need to understand the environment in which the agency is working and the kinds of services they offer and the people with whom they work. The final takeaway was related to practitioners finding most useful interactive activities to facilitate their learning. We asked what they did most regularly to become familiar with victim services research, and you can see here the top 4 things practitioners did was attend conferences and trainings and webinars, talking to knowledgeable colleagues, and attending in-person trainings. So all very much interactive, very much about communicating with other colleagues and researchers about what the research says and what it means. When asked about what was most useful to learn about basic data on victimization, so by this we meant prevalence statistics on victimization in their community or basic research findings around, for example, the consequences and outcomes of victimization experiences. Again, this was interactive types of experiences to learn about these learnings for the field, so attending conferences, in-person trainings, talking with colleagues. Asking about what's most useful to learn about research-informed practices, and so here we really are talking about evaluation research around the victim service offerings in the field. The same 3 come to light in terms of attending conferences, in-person trainings, and online training or webinars. Excuse me. In terms of asking about what do you think would be useful to further develop relationships with researchers, 3/4 of the providers said that researchers attending professional conferences would be useful to them, and 2/3 said that practitioners attending research conferences would be useful to them. So again, here we are showing that this type of interaction, opportunity to meet and greet, get to know each other, make matches in order to conduct research, seems to be a preference to the practitioner. So in conclusion, just to sum up again, the 3 takeaways we felt we heard in this survey were research and practitioner partnerships can occur without appropriate resources, that the relationships that are collaborative are ones that demonstrate understanding among both parties in order for them to be successful, so that practitioners have a role in decision-making and design input, and that the researchers understand the practitioner's work and their clients. And finally, that interactive activities facilitate learning about victim service research and building the relationships between the practitioners and researchers. Okay, and with that, I will pass it on to Stan.
Thanks, Jenny.
I'm trying.
I got it. There we go. All right. So as Susan mentioned, the JRSA's role was to conduct a survey of excuse me, victim services researchers, sort of paralleling the practitioner survey. So in order to try to understand the current challenges to developing research-informed practices and practice-informed research in victim services, to identify perceptions and experiences and strategies for facilitating research in this area. So we didn't have a list, obviously, so we had to come up with an operational definition of who the sort of population was for this. So we developed a number of criteria that you can see listed here, including folks who have published in the area, folks who have received research grants related to victimization victims, and members of relevant organizations like ASC's Victimology Division and ACJS's Victimology section. The survey, after we removed people who ended up being duplicated because they fell into multiple categories, was sent to just over 1,000 researchers, and we ended up with 257 total responses, 224 of which were we considered valid. And I think that part of the issue here is that a lot of those folks, especially the folks from the mailing lists, were not necessarily people who have actually done research or analyzed data related to victims or victimology or victimization. And we had a couple of screener questions actually in the research survey, which is how we got from the 257 to the 224. But my suspicion is that a lot of folks who just didn't sort of self-identify, if you will, as researchers in this area just didn't bother to respond at all, which would account for the sort of somewhat low response rate. Oh, I'm having problems here. Hold on. There we go. So, as you would expect, most of these folks that responded worked in academia. Most of them, the vast majority, held master's degrees and doctorates. Most of them had a fair amount of research, so over 80% had more than 5 years of doing research and or evaluation, and the vast majority had worked on multiple victim research and evaluation projects. So I think that we did get to the sort of right group of people based on their level of experience. Respondents tend to work, we got responses for most of the states in the country, and when we asked specifically about how supportive their institutions were of this sort of applied research, it was kind of gratifying that 85% reported that their institution was supportive of applied research, and the vast majority of the people in the sample are working at universities or government agencies. So that's kind of nice. We asked about backgrounds similar to the practitioner survey. Respondents worked on research in a number of different areas and used a number of different types of data sources. The majority conducted research on domestic violence and sexual assault, not surprisingly, and the most commonly used types of data were victim data collected on community samples and state and local victimization surveys. We asked a series of questions about contact between researchers and practitioners, and what we found, generally speaking, is that there was not a whole ton of contact between this set of researchers and victim services practitioners. So over a third of victim researchers reported that they did not work directly or closely with practitioners, which is 2/3 did, so that's good. Fewer than half became aware of research topics and needs by talking with victim services providers as opposed to, for example, reading research articles, talking to colleagues, so forth and so on. And only about half belonged to an organization that was specifically focused on victim research, like ASC's Division of Victimology. We also asked about perceptions about the capacity of folks in this area to conduct victim research. So what we found basically is that not a whole lot of difference between the perceptions of these researchers about themselves and other researchers in doing research in victim services versus researchers doing work in other areas of criminal justice. So for example, work satisfaction for these folks or their perception of work satisfaction for researchers doing work in this area was either comparable to or greater than in other research areas in their perception. Over 90% of respondents indicated researchers are as or more collaborative than researchers in other fields. Researchers most frequently indicated their ability to conduct research on these topics is no more or less difficult than other research areas, and researchers perceive themselves as similar to researchers in other areas of criminal justice in terms of qualifications, in terms of awareness of key research findings in the area, and in how well they translate research findings into practice in this area. In terms of impediments that we asked specifically about to successful research collaborations in victim-related research compared to other areas of criminal justice, the researchers felt that there was less funding available for doing research in this area as compared with other areas. that generally speaking there were fewer researchers that were involved in this area or that were interested in going into this area of research. And then we asked specifically about RCTs, and they said that randomized controlled trials were more difficult to pull off in victim services than in other areas of criminal justice. However, we also asked about the sort of the knowledge base and, if you will, the implications of that lack of RCTs. Excuse me, hang on. Sorry. And what we found was that just over half of researchers who expressed an opinion indicated that the knowledge base of quote-unquote what works in victim services is less than that in other research areas of criminal justice, which I thought was kind of interesting. About 3/4 of the researchers who expressed an opinion thought that it was more difficult, as I said, to conduct RCTs in victim services, but only about half thought that the difficulty in doing this actually affected the knowledge base to a significant degree, which was kind of interesting. So there's this sort of sense that among the researchers, or at least among those who expressed an opinion, and a lot of people didn't, a lot of people just said that they didn't know, that maybe what we know about what works in victim services is not as much as what we might know in areas such as, for example, corrections. And again, paralleling the survey of practitioners, we asked about perceptions of practitioners, and generally speaking, what we found was that researchers believe that practitioners on the positive side want to do what's best for their clients, can offer valuable insights for the research projects, and can be forceful advocates for research fundings. On the not so positive side, researchers also generally reported practitioners tend to fear negative research findings, and that they don't understand the practices and challenges of doing research in this area. We asked about work experiences with victim services organizations, and the vast majority of the researchers who had done research with victim services organizations or agencies reported that the staff of the organization had used the research findings most frequently in training, presentations, and in changing policies and practices. So that is encouraging. Oh, dear. There we go. In terms of dissemination, this is kind of interesting. Paralleling what you heard in the lit review that Jennifer talked about, 85% of researchers indicated that the dissemination of research findings to victim organizations is an important thing to do. However, and probably not surprising to those of you on this webinar, when we asked about how these individuals disseminate their work, they tended to do things that targeted academic audiences. So 3/4 presenting at research conferences, submitting articles to peer-reviewed journals, and relatively fewer than half, presenting at practitioner conferences, and very few disseminating through vehicles such as victim services publications or newsletters or victim services organizations or that sort of thing. So this clear disconnect between what researchers know to be important and what we see from the literature review and also from the practitioner survey about how best to get this knowledge into the hands of practitioners and the actual practice of these researchers themselves. Researchers stress the importance of establishing and maintaining good relationships to ensure that research findings are used by practitioners, and in fact 70% attributed research-driven changes in victim services to a successful researcher-practitioner collaboration. Over half reported that they had experienced successful collaborations with practitioners, which is heartening, and these successful collaborations were most frequently attributed to getting cooperation and support from practitioners and to getting agreement with the research plan. Just about a quarter of the researchers surveyed experienced an unsuccessful collaboration, and these were most frequently attributed to lack of cooperation and support from practitioners and concerns about research findings affecting funding. So you can see that the researchers kind of tend to blame perhaps the practitioners for these unsuccessful collaborations rather than pointing the finger in the mirror. In terms of problems experienced, fewer than a third of researchers reported problems with practitioners, which is heartening, I think. Among the researchers, the third or so that did report having some issues, the most prevalent issues were practitioners misinterpreting their research findings and then being asked to quote-unquote prove that a particular program or policy is effective. We asked about this, and this again paralleling the practitioner survey, we asked about strategies for effective collaborations, gave a list of these and asked about the sort of usefulness of them. And the ones that were rated as somewhat or very useful, actually most of them were, but you can see them here. So funding, of course, was almost universally supported, presenting at practitioner conferences, practitioners' presence at professional research conferences, matchmaker databases, and then networking meetings were all seen as effective strategies or useful strategies by more than half of the researchers. Several also offered suggestions when we asked about how to improve relationships, including treating practitioners as partners in research rather than as objects of a study, presenting findings so they can be understood, and making the research relevant, showing the practitioners how the findings can improve outcomes from their particular situation. So, researchers believe collaboration is important and beneficial for research and victim services organizations both. They believe that practitioners can offer valuable insight into the research, service funding advocates, and that collaboration can produce research-driven changes in victim services, which is very positive. Researchers and practitioners the researchers also believe that they should forge closer relationships with the practitioners and at those using these various methods that I mentioned earlier. And so that's my last slide. So I think at this point, Susan, I'm going to hand this back to you. If you can introduce Sherry, that would be great.
Sure, thanks so much. We are pleased to have with us today Sherry Hamby, who many of you must know. She's a very well-regarded researcher who also, I would say, wears a practitioner hat because she cares so much about victim service practice. She has a great reputation in the practitioner field as well as the researcher field. She participated, she was one of the experts that we interviewed and then also participated in our roundtable of stakeholders. And so we've invited her to share her reflections on bridging the gap between research and practice and the findings from the research sections. Sherry?
Thank you, Susan. Can everybody hear me okay?
Yes.
Yes, okay, terrific. And thank you so much for inviting me to join you today. I just really want to give my regards to the entire team for what I think is an impressive and also incredibly important effort to work on this problem of trying to make better use and better communication between the research and practice communities. And I basically have organized my comments around 3 points that I hope that you will take away with you after listening to this today. And the first of them I call WHISTLE, or it's really my version of one of the very first things that Susan said during the stakeholder meeting, and it's what would success look like. And I think that is such an important and under-asked question for this problem and really for so many of the other problems that we face, perhaps especially in the research world, but I think many times also in the clinical and grassroots world as well, because it is so easy to sort of point to the challenges and point to the problems and point perhaps even to places where we have all fallen short. And it is difficult, much more difficult to really think about solutions and strengths and what lessons can we take from the successes that we have experienced and disseminate those and spread those to other people. And so I have really, Susan, I have to tell you, I've spent quite a bit of time since we had that in-person meeting back in the fall, turning that sentence over in my head. And so I'm not necessarily sure I'm going to be completely able to answer it today, but I do think that that is the #1 key question that we all need to be asking ourselves about the research to practice communication. And my next 2 points are at least hopefully some partial thoughts about what answers for that might look like. And the second point I am calling plug and play, because I am one of those researchers that has done a fair amount, and I'm also trained as a clinical psychologist, and I have experience as a grassroots activist and a therapist as well as a researcher. And I think one of the sources of the disconnect is that we spend too much time talking about different levels of analysis, and lately I have gotten interested in trying to think about metaphors from other fields, and so I offer a couple of quick ones, one from medicine, that if you're a cancer researcher, you might spend a lot of your time, looking at, RNA sequences and DNA sequences and how a drug, attaches onto the outer membrane of a cancer cell and destroys that cell. But which is all good and important, and hopefully, most of the oncologists out there would understand that. But when you talk to the oncologist and say, they've got a patient in their room, they're going to have, as we know, a lot of pressure to see that patient very quickly and create a treatment plan under an enormous time pressure, and they don't want to start with, genomes and, and transcription errors and things like that. They just need practice guidelines, and I think it's mostly, I put it on us as researchers, that when we communicate with practitioners, and I see this over and over again at the trainings and workshops, that we start with, the DNA sequences and, and then we lay out all of the work that we've done, and then in the end, very often, and this is very short piece of time, we say, well, and okay, and of course this can be, translated into practice guidelines with like new medication, but we don't really lay out what that would look like. And so I think that we really need to do more on the research side of the community to making that bridge. TK Logan suggested while we were there that possibly doing some kind of practice guidelines, and then the other day she sent me a sample from a journal that I won't name, but I think one of the problems with it is that it was just sort of cut and pasted all of the discussion sections from these journal articles that were still at this very abstract level of analysis and didn't really address the question of, okay, tomorrow when you go back into your office and you've got this string of clients waiting for you again, what could you do differently or what should you do differently? And that's just really an essential step that somehow the two communities need to come together and work more on that translation piece, between the chemical structure of these medications, if you will, and what that looks like, on a prescription, which is a gap that is getting addressed in medicine and is not getting addressed in victim services. And the third point I just want to make very briefly is I'm calling the untold stories. And I think another piece that emerged out of all of the work that you've done and that several of you mentioned today was this need to put a human face on things and this need for interaction and the benefits of interaction between these communities. And one of my takeaways from that is that when we tell stories in victim services, they tend to be victim stories and stories about trauma and stories about victimization, which I think are important and necessary, and a lot of the reason why we have even had the huge social change that we've had in the last 50 years or so of finally, recognizing and making it a policy imperative and a public health priority to work on the issue of victimization. But pieces of that are missing are research stories and practice stories. And I think that could be one way to help translate across these levels, is to use narrative. I think it's an important way to translate across these levels. I was at a meeting of the National Latino Network also earlier this fall, and I'd never been to Casa de Esperanza's main facility, where they have literally built an entire apartment complex for transitional housing for women and children who have been through domestic violence, when in most cities, even much bigger cities, they probably have a handful of transitional housing apartments, if they have any at all. And, I think that would be a fascinating story. Like, how did they accomplish that? How did they achieve that? What a wonderful, terrific story with this lovely, happy ending that you could really use as a model that would help other people. And at the same time, on the research end, I think we have conventions in our field, and I think, Stan, you talked a lot about some of the pressures on academics, regarding RCTs and, sort of the finding the time to invest in these things. But another convention in the research field is that we often write our journal articles in a way that just kind of presents them as a fait accompli, like, look at this beautiful thing I've created with these beautiful statistics and all of this sort of stuff, which is good and certainly valuable too, but we miss the sort of the struggles, we miss the questions, we miss the difficult choices about why you ended up, talking to these people and not those people, or asking these questions and not this question, or why you couldn't, ever get this information. And I think if we really wanted to have better understanding of these pressures that both of these communities experience, and both of them are under so much pressure, and I think, on the clinical side, there's funding pressure, which of course is the same on the research side, but there's also all of this pressure to provide more services to more people for less money. On the research side, the expectations for getting external funding and the expectations about numbers of publications, all of these things just seem to be on this constant upward trajectory, and it's very hard to carve out these sort of precious spaces for us to sort of meet each other and listen to each other and get to know each other. And then when we do that, so often we just kind of come and talk about our accomplishments like they were nothing to it and easy. But I think this idea of like research stories or practice stories or advocacy stories would be an important piece to add to better understanding between these communities, and shifting off of all of their stories only being about the trauma that our clients or participants have undergone. And so I will stop there and invite Stan or Janine or Jennifer or Susan to make any comments about that, or I guess you wanted to also leave time to open it up for questions, and so I want to make sure we have time for a broader discussion as well. So back to you, Susan.
All right, thanks, Sherry. Well, I loved your comments. That is really putting everything that we found into concrete terms for people. And I couldn't agree more that it would be helpful for to really learn from each other, both on the practitioner and the researcher side, about these collaborations and what worked, what didn't work. How did you progress? Where were your stumbling blocks? How can we move forward? I also agree with the vision statement. Just thank you so much for all that. I want to remind everyone out there that there is a chat box, and we welcome your questions. I'm sorry that with this many participants, it would be too hard for us to just open the phone, but if you will type your questions in that box, we have, as they say, researchers standing by. But while we wait for that, I will open it up to Stan, Janine, or Jennifer, if any of you have additional reflections on Sherry's comments. Everyone's looking for their
This is Janine. I also appreciate Sherry's comments, and I would really echo the final comment around other stories that tell us about what it means to do victim service research and participate as a practitioner or conduct it as a researcher, because I feel like there's so many lessons learned out there that we're not sharing with one another, and then researchers are left to sort of reinvent the wheel, reinvent how to make this happen in an appropriate and collaborative way. And I think those kinds of stories would be incredibly informative for the field.
Thanks. I'm sorry. I missed my own mute button. This is Susan again. Jennifer or Stan?
Yeah, this is Jennifer. I just want to echo my appreciation for Sherry's comments, and particularly to move forward, we really do have to focus more on the solutions and the efforts of overcoming the barriers that we've already identified numerous times. So I do completely agree with that.
Yeah, and I would say that, I mean, a couple of things. First, it strikes me that, and I think we had this conversation a little bit at the stakeholder meeting that we held, which is the value of people being able to get together and share information has become so difficult now with the limited or non-existent funding for conferences and meetings. So I think that really is a potential drawback. On the researcher survey, the only method for improving collaboration that researchers didn't really endorse was this sort of online webinar sort of approach. And so even though that's what we're doing today, and it certainly has an efficiency of reaching a number of people quickly, I think we're all already suffering from webinar fatigue. And I think we all have experienced the, you know, the fact that it's just there's no substitute for sort of in-person, you know, face-to-face contact, especially when you're trying to sort of break down those barriers or share those sort of different perspectives that Jennifer talked about at the very beginning of those literature review slides. Where you know, that we're just coming at this from different sort of different perspectives. The other thing that I would say is that you know, having been worked on this now for, oh my goodness, I don't know how long we've been working on this. It feels like forever, but at 2 years, 2.5 years on this project, maybe more. I've been just really impressed with the level of knowledge out there from the victim services folks that we have talked to about research. And I think, you know, obviously a lot of this is self-selection. You know, we're talking to people who know a little bit more about research, and we're talking to researchers who are a little bit more cognizant of practitioner needs and so forth. But there really is I mean, both a fair amount of knowledge, a fair number of people who, like Sherry, who have been trained in both areas, and just a real thirst, I think, for information, for research information. And I don't know that that as researchers, especially our brethren in academia, are really appreciative of that or understand the importance of learning how to communicate with those folks, both getting them involved as equal partners in research projects, but also being able to, you know, disseminate your work to them in sort of a meaningful way and telling them why it's important for them. So I think that there would be a real audience for that if we could just somehow get more research folks on board with it.
Yeah, absolutely. I agree with everything that you've just said, Stan, which just shows that we've been working very closely together for a long time. I think it is now almost 2 years. But you know, a lot of what you said we heard from so many of the experts and interested people that we've talked to throughout this project. I am, for one, leaving this project hopeful, as you are, Stan, that there is progress to be made and an excellent cohort of researchers and practitioners who are poised to make it. So I look forward to what's going to happen in the next couple of years in this area. I'm still not seeing any questions from participants. I'm sure that when Stan sends out the link to the recording, he will include all of our email addresses, and we'll be happy to answer any additional questions that you have. Wait, Stan, I think there may be a question there if you can see that. Ah, yes, it's from Ted. Yeah, we're seeing some good ideas being shared. But we'll also share our email addresses and welcome your feedback that way. I see a couple of the comments that we do have are private messages, so I'm not going to share those now. All right, Stan, would you like to close us out, as they say?
Susan, can I just jump in with one last comment?
Sure.
One of my other hats, as well as Susan and Stan and Jennifer and Janine already know, is also editor of Psychology of Violence. And as one of the things I am hoping to do there, and that I do have a few people working on, is to publish more of these lessons learned and more of these research or research and practice partnership stories. And so if anybody is interested in writing a brief commentary, or if they know anybody that is interested in writing a brief commentary, please feel free to get in touch with me about that. I am actively soliciting that type of work so that we do start to have that out there where everybody can access it, and not just from purely informal conversations among people.
Oh, that's a really great idea. I look forward to seeing that. And if anyone out there is looking for an excellent practitioner conference to present your work, the National Center for Victims of Crime will be having our conference in Philadelphia this year in September. And we are always interested in research-based presentations, particularly those that have co-presenters, researchers, and practitioners. So just contact me or see the National Center for Victims of Crime's website for more information on that. And now back to you, Stan.
Thanks, and thank you all for attending this afternoon. I've posted the poll and opened up the poll, so we'd appreciate if you take a few moments to fill that out. Thank you all. I want to thank everybody who attended today, and thanks to all of our presenters. I hope you all got something out of this and learned something about it. JRSA and our other organizations here offer many webinars, so please feel free to get in touch with any one of us if you want more information about any of those topics. Thank you all. Have a great afternoon.